Welcome back. Well, our guests from 7-Day Dental today, I think you know both of them, Dr. Christine Chung and Dr. Chuck Lee. Today we're going to talk about not your teeth so much. We're going to talk about a condition that affects probably millions of people in one way or another called sleep apnea. And it can be something that's just discomforting to life-threatening, right?
Yes.
Yes, good morning.
Good morning. So tell me about sleep apnea in general.
Well, sleep apnea is a very serious medical issue where you stop breathing for maybe 10 to 20 seconds during a night, and it could be happening 100 times overnight. Wow. Yes, and so it can be serious that most people, they don't know about it and they thought it's just a common issue. But we do encourage you go find out and do diagnosis on sleep apnea.
Okay, how would someone, especially I think if you have a spouse or partner that you're sleeping with every night, they may be able to kind of detect it. They may hear you gasping for air or something. But beyond that, maybe you live alone and you're having that. How would you know? I've often heard that people who with sleep apnea wake up in the morning tired. They say, I did not get a good night's sleep. That could be a variety of reasons, but how would someone kind of know?
Well, today our technology is so advanced, we can actually record with their phone. They can record one if they're snoring.
Okay.
And they can record. The problem is, the reason sleep apnea is such an underdiagnosed field is, one, how us dentists pick up a patient that have sleep apnea is because we get the chance to look at their teeth. When we see teeth that are have been worn down, the enamel has been worn through, we know that that patient has a high degree of having high susceptibility of having that disease, sleep apnea. And so a lot of times I would ask the patient, hey, do you snore? And a lot of times they would say, yeah, my husband or my wife has told me that I do snore. And that's how we start the conversation about sleep apnea.
Okay. And once that you think you might have it, or your spouse tells you snore or something like that, what is the first step? Because it still doesn't mean that you have that. What would you do to maybe figure out that they have it?
Well, usually what we do, we tell the patient to, we have a questionnaire that they fill out.
Okay.
And if they score a high score, then the probability of them having is higher. And we refer them to their sleep specialist that does they do the sleep test.
Yeah.
And sleep test is cool nowadays because you can either do it the take home, where you do it in your own home and your own comfort, or you could do it at the sleep center.
Right.
And once you do that, then you send the package back if you're doing a home test, and the sleep specialist will evaluate the data and diagnose based on the data.
Okay. Very good. Now, okay, go ahead. You're gonna.
So what is sleep apnea is when you're asleep, you're lying down, it's the soft tissue in the back of the throat relax, and so the airway get obstructed and you can't breathe, and therefore you have lack of oxygen throughout your body, your brain, and so that's very serious, and if left untreated, it could lead to other medical issues such as diabetes, high blood pressure, stroke, heart attack.
Let's talk about the treatment.
Yeah. So let me just elaborate on the bruxism.
Okay.
So people that grind their teeth, when we ask them, do you know you grind your teeth? They all assume that it's due to stress. But yet there are 4-year-old kids that are grinding their teeth. And a lot of people think it's because they have 4 jobs and they have a mortgage to pay.
Right.
But not on kids.
Right.
So that's the joke about it. But so when we know that the brain sends a message to our jaw to clench down so that we can open up the throat muscle and get more oxygen. And so that's why the dentist may be the first person to find the patient that possibly might be sleep apneic. A lot of people usually that have sleep apnea usually overweight, but there are some that are skinny and they're getting it. So
Okay.
that's why a dentist is the first line of a provider that can diagnose it.
Okay.
How we treat is usually the gold standard is patients that have severe sleep apnea. The gold standard is to have them wear a CPAP.
Right.
CPAP is a mask machine that's stands for continuous positive airway pressure.
Right.
Now, a lot of patients don't like wearing that
No,
because
I
it
can
feels
understand.
like you're sticking your head out of the window where you're driving 80 miles an hour because
Yeah.
your air is blowing so much. However, so a lot of the patients that have sleep apnea have to wear the CPAP. They don't wear it, not
Right.
every night.
Right.
So that's where we come in as a dentist, because now dentists can provide dental appliance, and there's over 1,000 appliances, so we have to see how you are. Each one is personalized to that patient, and we're able to make an appliance that can, allow them to have less sleep apnea.
Okay. When you say
episodes.
appliance, it's like a mouth guard type appliance,
Yes.
mouthpiece type thing?
It's a little bit, yes, it looks like that,
Yeah,
but it's,
yeah.
it's actually doing more than that.
Okay.
So in our office, we do have a specialist that treats sleep apnea.
Okay. And as far as getting fitted for that, or is it sort of you just said there's several of them. You kind of maybe go through different ones that might work the best for the patient.
Yeah, and there's a new one, because see, I have sleep apnea, so I know this disease
Okay.
inside out. And there's a new one where we can make you a tray, and then you go to the sleep center, and they are able to move your jaw while you're sleeping to the point where there's no more arousal, no more snoring, no more disturbances, and that's where we will make the appliance. And then with that, we see the highest
I see.
result of success.
Very good.
Yeah, it's
Yeah.
very cool.
Well, I can understand that how serious this would be. What is something you wrote down here that I haven't heard of? Maybe it's the condition here, bruxism.
Bruxism is the grinding of the teeth.
Oh, grinding of the teeth.
Yes.
Okay, that's right.
Clenching or
Okay,
grinding, yeah.
and that's sort of an indication that something could be wrong as
That's
far
right.
as that goes. Well, I can see how really detrimental this could be in many different ways, and how you can help out.
Yes.
So the first step is, of course, again, as I said, there could be people who live alone that may not know that they even have this. But I would think that if they're waking up at least tired every day, that certainly could be an indication to come in and get things checked out.
Yes, or sometimes they have jaw pain
Okay.
right here. That's
All right, very good,
big
yeah.
signs of clenching,
Yeah.
grinding your teeth overnight.
All right, very good. So 7 Day Dental is online, and you can get information there. Their Laguna Woods office is right over here at 949-858-3988. And go in and get things checked out. You may know that you have a problem when you sleep each night, and this is certainly the first step to really get it figured out and eventually get help for it, right?
Yes.
Yeah. So thank you very much. Good information. And again, you guys are located over here on Moulton Parkway, so close by. 7daydental.com is for all your dental needs, not just sleep apnea, but today we wanted to talk about that.
Yes.
So-
So if you think you have sleep apnea, come on by for a free consultation.
All right, very good. Nice to see you both.
Thank
Thank you.
All right, take care, and we'll be right back.